Dr. Shelley Spangler is a licensed veterinarian in the state of Virginia. She's a native of Delaware, where she received her Bachelor of Science with distinction from the University of Delaware. And she graduated with her DVM from the Virginia Maryland College of Veterinary Medicine in the year 2000. She is married and has three kids in middle and elementary school, and she is fur mom to two dogs and eight cats. Dr. Spangler's 17 years of clinical experience includes traditional small animal practice, high volume spay neuter, and shelter medicine. She served as veterinarian in charge at the Roanoke Valley SPCA, Franklin County Humane Society, and as medical director of Angels of Assisi in Roanoke, Virginia. And that's where I met her when I was a fourth year veterinary student doing my clinical rotations. She recently returned to traditional small animal practice as owner director of her own veterinary clinic. Dr. Spangler's shelter medicine experience included managing a high volume, high quality surgery clinic and a high volume wellness clinic, while also managing the health of adoption center and foster care animals at a nationally recognized organization. She also completed certificates in forensic medicine, which enabled her to testify in numerous animal abuse and neglect cases. So really, really interesting history. Do you mind if we start with a little bit back in your history, just like with your formative years and what made you think that you wanted to be a veterinarian?
Absolutely. I think, what made me want to be a veterinarian is what makes a lot of young children want to be a veterinarian. I loved animals. I enjoyed being around them. I wasn't able to have very many because I had siblings with really severe allergies to animals. So we had one dog, and I kind of craved being around animals a lot more than I was able to. And I grew up in a city, so I didn't have large animals. And I really enjoyed just working with animals when I could. I also had like an intense interest in science, and so when I got into high school, it just seemed like a natural fit for me. And when I was about 16 or 17, that's when I decided that I was going to try to go for it.
Okay. So you had allergies to animals, and yet now
I did it myself.
What's that?
My brother did. My brother had intense allergies.
Oh, your brother.
So we couldn't have cats, couldn't have rabbits. We could have dogs, and we had one. I was allowed to have just one. So we even had a bird at one point, and he was allergic to the bird. So
wow.
I was just limited by, my sibling, and my parents, weren't animal people either. So I kind of grew up with just having one dog and loving every other animal I could come in contact with.
I understand. So then when you were in high school, did you work at animal clinics?
When I was in high school, I did not work at an animal clinic. I did volunteer at our local humane society on weekends, but when I got into college, I had a part-time job and full-time in the summer where I did work with animals. So I was working with like the boarding and grooming side of animals. It was a really good experience because I got a lot of handling skills. I learned a lot just about behavior of different dogs. I learned a lot about behavior of cats when they're stressed, and I had not had a lot of cat contact prior to that because of my brother's allergies. So it really wasn't until I actually graduated from vet school and started working like more directly with cats that were in a boarding situation that I realized that I loved cats. I definitely have become a cat person later in life, where I was definitely a dog person early in life.
Okay. All right. So before vet school, you didn't, like when you were in college, you didn't do some hours in a veterinary clinic in order to...
I actually had not. The clinic that I worked for, there was a small hospital, and then they also owned, the same doctor owned like a boarding and grooming facility that was separate but in the same building. So I was around the hospital, but I really didn't ever work directly in the hospital. Did a little bit of volunteer work. But I got to see some of the things they did. I just didn't really do it. I wouldn't have called myself a veterinary assistant or anything. So my clinical work really didn't start until vet school. I had had a lot of large animal experience in college. I did an animal science degree. I worked with cattle, worked a lot with chickens, a little bit with horses, and I actually ended up doing a thesis, a senior thesis, as an undergraduate with a research project that I did for about 2 years. So I had a lot of research experience and large animal experience and just a little bit of small animal experience, but that combination was really helpful in getting into vet school.
Oh, I bet. Yeah. And I bet your large animal experience as an undergraduate was helpful when you had to do your large animal rotations.
Absolutely.
Yeah.
Absolutely.
I think for a lot of
I think
us that just did small animal, that it was like a shock, like, oh my God, they're so big. Yeah.
it was nice to have a lot of that. I think I actually tested out of some classes in first year
Oh,
that uh, that we were able to test out of. It was like handling classes. So I tested out like the small animal one, and I tested out the cattle, sheep one, because I had enough experience to be able to go in and answer the questions. I think I did end up taking the equine. And there may have been another, but just having that experience was definitely helpful going.
I bet. Okay. So then when you started veterinary school, tell me about if did it meet your expectations? Was it different than your expectations? What was the biggest surprise?
Oh, that's a good question. I think from an academic standpoint, the first year was was all a repeat for me. I I think anatomy and histology were the only new classes that I had had all the other classes previously,
Yeah.
and that was a bit of a disappointment.
Yes. Yes.
um, but in general, I thought it was very challenging. But I think I expected it to be challenging. I think the hardest part was in the third year and feeling like I had already burned my. I believe that's probably pretty typical. Um, I think if I was to do it over again, I would try to pace myself better. But
Mhm.
it met my expectations on an academic level. I was very surprised that socially it was a lot like high school, and wasn't prepared for that. I think I had gone to a small high school, and then I went to a huge, college, university, and I wasn't prepared to go back to the small high school experience. And socially, it was very much like I think that was the most shocking thing about school.
Dr. Spangler, I'm sorry to interrupt you. You're sort of phasing in and out. I wonder if you might be a little bit too far from the microphone.
Get hold of here. We'll see if I can.
Okay, let's try it again. So you were saying that you were saying about the social environment of high school that it was a lot like high school. Vet
Yes,
school was like high school.
yes. I found that it was very much socially like getting back to high school. And I've heard that from other people as well. I think spending a small class together for all day long, every day, was interesting, to say the
Yeah.
least.
Yeah, I found it tough. I was an older student when I went back, so I sort of avoided the cliques because I don't know, I'm just too old for that stuff. But luckily, I had some older students and we bonded. But I could definitely see, little dramas going on and
Yeah,
forming. So, yeah,
yeah. I think that was the most surprising thing.
yeah. Did you find a group of people that you really clicked with and that you remained friends with throughout vet school?
You know, I never really had that. I'm sorry, I never really had that group of friends. I did end up being really close to one other of my classmates, and she is in Nevada now, but we still talk every week.
Oh, every week. That's fantastic.
Yeah.
Yeah. Yeah. I think that if you form bonds in vet school, my guess is they'll probably last lifelong because it's such it's a difficult 4 years.
It
Um,
is.
so what was the best thing about veterinary school for you besides, loving the academics?
Um, so the best thing I think was meeting people on a professional level because I still, even though we may not be friends and talk every week, we still talk to each other on a professional level. Meeting professors and having those contacts to rely on as well in
Hmm.
the years after graduation because I definitely was emailing and calling people and asking opinions. And they're always really gracious,
Oh, that's
you know,
great.
responding to me.
Yeah.
They're really helpful.
Okay. And then you said that you felt burnt out by the time you got to third year. Was that the worst part?
That was the worst part.
How did you how did you manage? Because third year is that's when you really start learning the clinical side of medicine. And so how did you come out of that, or how did you manage your motivation?
It was tough at first. I think my grades probably suffered a tad. I mean, I usually was like A or B student. I got a C or two one semester because my study habits, I kind of backed off on it a little bit. I took the approach of resting, trying to do some things that were fun for me when maybe I normally wouldn't have and would have been studying, and trying not to worry about it. I had a great friend, friend I mentioned that lives in Nevada, and she would help me study. And so during my really tired times, she would kind of be there to help me, force me to come and study with her. And it slowly improved. So just resting and knowing that um, I didn't have to put 100% into it for a time period was really easy. Um, and then I was able to get back to putting 100% into it.
Okay, right. Yeah. Yeah, I think that's really wise to just tell yourself you can't you give yourself permission not to give 100% when you're feeling burned out, and just wait for that motivation to come back on its own.
I
S-
remember telling myself that that old joke that what do you call the person that graduates last in their medical class? A
Doctor.
doctor. So, you know, I realized that I didn't have to get A's all the time. I could get a B or a C even if it did hurt me. Um,
Yes.
you know, I could still graduate and work as a veterinarian. So,
That's great. Yeah. And the people who end up getting into vet school, I mean, they're gunners. I'm sure you were a gunner all the way through your
yeah,
undergraduate courses, and you are used to getting A's. So
exactly.
it hurts when you get a C. I got a C. I think it was second year for me that was my roughest year, but I got a C, and wow, that hurt. But okay,
Yeah.
um, so when you graduated from veterinary school, how much, if you don't mind my asking, because every podcast we're gonna focus a little bit on finances, because it's becoming a bigger and bigger challenge for a veterinary graduate. So if you don't mind my asking, how much student loan debt did you graduate vet school with?
I graduated with about $80,000 in student loan debt.
Okay, and then if you don't mind my asking, how much do you have now?
I still have about 60,000 left to
Yeah,
pay.
right.
For a 10 period, I did have my loans on forbearance, just a period of my life where financially just wasn't going well. And because of that, I ended up getting a little higher, you know, up about 100,000. So
Wow.
now I'm really working at trying to pay it off.
Yes.
And I figure it's going to take a while.
Yeah, it's amazing. Do you so what are your interest rates? Have they been variable, or have they been the same the whole time?
Um, they varied a little bit, but I ended up locking them in. And so I think I started off at like 60%, but it's down to like 4.75.
Oh, that's not bad. 4.75
Yeah.
on student loans is a lot better than what a lot of people have. Okay. Alexa just started talking to me. She's in the background. I should have darn it, shut up. Shut up. Yeah, so and as far as forbearance, I've gone through periods where things were up in the air and I was financially unstable, and I think that a lot of vets have. So um,
Uh,
and then that interest just keeps piling up, and you get further behind. But I've got a good friend who I'm actually going to be interviewing for the podcast as well, and she had a similar situation where she's been out of school for over a decade. And the number is still the same. The debt number is still the same.
yeah, it definitely happened.
Yeah.
You know,
So
I
when
think
you
I
were
started my.
oh, I'm sorry. Go ahead.
I was when I started my very first job. I made 40,000 a year, and that was in 2000, and that was pretty average for the area that I was working in. But in calculating how much I needed to live the lifestyle I wanted, which was a little bit better than vet school,
Uh-huh.
and then pay off my student loans, I needed to make about $10,000 more than that.
Right.
So it was pretty low to start.
Yeah. And that is so that's a 2-to-1 debt to income ratio. And the AVMA, I've read some of their recommendations, and they typically say you want it to be about 1.4-to-1. But I've read other financial advisors who say you want your salary coming out of school to be more than the total sum of your debt. And I don't know any vets who approach
Yeah.
that. Yeah. So your first job, let's talk about that if you don't mind. When you graduated from vet school, tell me about your job search prospects. Was it really easy to find a job? And when you finally decided to work at that, what was it that made you want to work there?
So my first job, looking back, it was pretty easy to find a job. I was worried at the time that it would be very difficult because I was staying in the general area of the vet school because my husband had a job and wanted to stay in the area. So I was worried that I would not be able to find an appropriate position.
Sure.
I
Blacksburg.
think I accepted an offer maybe a little early, but overall, it wasn't too difficult to find that job. The clinic I chose, I think, because they were really relaxed people, and they were in an area that was close to where I was living. They seemed to have a pretty active business, and I thought I could learn a lot. And the owner really liked the idea of being a mentor. But it ended up that he really wasn't very good at mentoring. And I maybe didn't learn as much as I would have liked, or at least I learned bad habits that I ended up having to change quite a bit. I think
I'm sorry to interrupt
most
you.
shocking.
Did you know that they were bad habits when you were learning them? You did.
I couldn't hear you there.
Did you know that they were bad habits when you were learning them?
No,
Uh-huh.
no, I did not realize. I was so naive. I didn't realize I was learning bad habits. After a little while of practicing, I could tell that they were bad habits. But no, anyway, I learned because he was very relaxed. A lot of things were too relaxed, and I learned that eventually. One of the things I think that was shocking about going into private practice directly out of vet school was that staff was not trained as well as I expected them to be.
Ain't that the truth?
And so it's a huge learning curve for me to go from the vet school where the staff is very reliable, know what they're doing, to a typical small practice where the education that they get is pretty limited and their skills are very overestimated.
Yeah.
And there are some practices that are better than others, but overall, I was kind of shocked at the skill of support staff.
Yeah, I think this is a very common experience for new graduates. I had the same. I went into ER first, so those technicians were great. But then when I went to day practice, oh my goodness, I had to do it. I didn't know how to. So then when you started practicing, how did it feel trying to apply all of your academic learning from vet school to the real world? Did it feel awkward or was it just natural?
I would say it was awkward for me. um, in vet school, you learn a lot of information. I mean, they have to cover a ton of information. But then when you get into practice, you see the same things over and over. And you become really comfortable in those things. When you're first out of school, the comfort level is pretty low. And you're looking for zebras, you know. You're looking for things that you've learned about all these years
Be
that
excited.
maybe aren't there. And I think for me, finding the balance between really doing good medicine and having clients that couldn't afford to do all the diagnostics that we were used to doing, I had to really work at that. So it was a bit awkward at first.
Yes, yes. And you were at that practice for how long?
3 years.
3 years. Okay. And that was small animal only. You weren't doing mixed.
Correct.
Okay. 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 Because Blacksburg is a pretty rural area. So I bet there's a lot of mixed practices out there as well.
Yeah, I was in Salem.
Oh, okay. Okay. All right. And so after 3 years, what made you decide that you wanted to move on?
I had a few things come together. One, I was expecting a child, and I was going to take a step back and not work as much. The second thing was that I knew that the practice had some bad habits, and I really didn't want to be involved in that anymore.
Mm-hmm.
I had planned on actually leaving veterinary medicine and opening up my own boarding and grooming facility.
Oh, wow.
In the meantime, I was going to do some relief work just to make a little extra money. My husband ended up quitting his job and working in real estate. So I ended up working a lot more doing relief work than I anticipated, but I found that I loved it. I really loved the variety, learning how to use different medications that different veterinarians use, how different veterinarians approach, the same topic. It was really enlightening to see that veterinary medicine can be totally different than what I had just experienced in the past 3 years. And so I ended up actually deciding that I was going to stay in veterinary medicine.
Wow. Wow. So that first 3 years out of vet school was so rough for you that you were thinking of just walking away. Yeah. I don't think that's uncommon either. And then doing really year round. That's amazing.
Yeah.
So then you did relief work, and then at some point or another, was your next job medicine?
So while I was doing relief work, I had the opportunity to take a part-time position as a shelter veterinarian at the Roanoke Valley SPCA. And I loved that. I really enjoyed working with shelter animals. I did a lot more surgery. And I found it really rewarding, although it didn't pay very well. I still did some relief work for about 6 months. and then they asked me to join them full time, which I did for a while. The only reason I left there is because another humane organization offered me a lot more money.
Mm-hmm.
And I went to that clinic. I was at Franklin County Humane Society. And they, at the time, only had a spay-neuter clinic.
Ah, yes. So you got offered more money to go to, and that was Franklin. That was a Franklin County Humane Society. Now, I'm curious. So when you were a part-time veterinarian at the SPCA there, um, were there other veterinarians as well?
No, so I was their very first veterinarian on staff, and the whole time I was there, I was the only veterinarian. And actually, to this day, there's only one veterinarian at that particular shelter. My day there consisted of intaking new animals, doing physical exams, vaccinations, heartworm testing, deworming, checking fecals, and doing surgery on the animals that had been there. Did spays and neuters. We did rabbits and mostly dogs and cats. And I did probably 70 or 80% early spay and neuter because there was almost all puppies and kittens at this particular shelter. I had one assistant, typically. Sometimes it was actually an LVT, and sometimes it was not an LVT.
Wow.
I think the piece in general, compared to later years working at Angels of Assisi, that pace was fairly slow in comparison, but I still did sometimes like 10 to 15 spay or neuters a day. It just depended on how many animals we had waiting for surgery, how full it was, that sort of thing. We did treat sick animals in house, so if we had animals that were sick, I was in charge of taking care of them as well. It was a faster turnover, so I don't know how long the average stay was anymore. I just can't remember that long ago. But animals came in and went out pretty quickly from that particular shelter. So I didn't have a lot of sick animals.
Okay. And it's a completely different kind of medicine, shelter medicine. I mean, of course, you're still taking care of sick animals. It's dogs and cats, or what you were used to, small animals, but it's population medicine, and the surgery is different. You've got high volume. So how did you learn to do that? There's no other veterinarian there to help you, to teach you. How did you learn to do that?
A couple things I did. At that time, there was another veterinarian in the area that was doing spay neuter, and I did a little bit of work with her so that I could kind of get an idea of the flow that they had at the clinic, and see some technique things that may help me. I also joined the Shelter Veterinarian Association and got on a listserv that shelter vets use to talk to one another, and that was really helpful as well. And coming up with drug protocols that would, be safe but quick to wake up, pain medications that they were using that maybe were cheaper and could be used like on a mass level, and future choices, that sort of thing. It was really helpful early on in my career. When I learned how to do scrotal incisions on puppies, at first I learned in school never to cut the scrotum, so I was a little bit resistant to do it. So I started reading it. I did a ton of early neuters, and I just found myself slowly moving my incision more caudal onto the scrotum. I read about it more, and I was like, man, I'm just going to do it. And I started doing it, and I love it for puppies. I did. I think just looking for information and trying to get as much as I could on shelter medicine. That plus then doing it and getting the experience. I learned a lot from just experience.
Right, right. And so for the scrotal, and it's so interesting because we were taught that as well. I mean, I went to the same school you did many years later, but we were taught that as well. And but that's how we do it in cats. So why not like the young dogs that have little teeny weeny testicles? So and
Yeah.
after you did it, it seemed to work out fine.
Oh, yeah. I mean, they never bothered it at all. The actual surgery was a lot easier, so much faster. Um, Now at this point in my career, I can do it without suture. I just auto ligate it with a simple overhand knot on each side
Just like
and
cats.
use a very small incision and a little bit of glue, and it's like 3 minutes.
Wow, wow, yeah. Okay, and so when you say that you looked for information, so you first of all you approached this other vet that was doing high volume spay neuter. You just
Hmm.
called her up and said, "Hey, would you mind if I come in and just watch or help you out?"
Yes, I had done a little bit of relief work for that organization, so I knew her um, and knew that she was very approachable and liked to teach. At that time, she had students coming in and um, working with her, so
That's
it was,
great. Okay.
she was very open to teaching people how to do things.
Okay. And then when you were doing reading and stuff now, so this would have been about what, like 2005, 2006, around then. Was VIN available, the Veterinary Information Network, or what kind of
No,
sources did you have to find this information?
the Shelter Vet Association was my biggest um, contact. So, yeah, their listserv, which they have, it's a slightly different process now, but they used to have a listserv, and um, I could find other sources of information from that, and I could talk to people who have been doing it for a while, people who taught shelter medicine early on, really early on, and so I could get more information that way as well. I learned a lot from it.
Okay.
Um, since then, there's a lot more places available because there are shelter medicine programs now, so you can go to those schools' websites and look up information. You can even do a master's now in shelter medicine. So.
Okay. Yeah. Yeah. I just started looking into that. All the different opportunities are available in terms of formal education. But when I was at
Yeah,
Virginia Tech, I I do not recall having even one class that talked about shelter medicine. Did you?
no, I didn't.
Okay. Okay. Yeah.
Now it's a completely new field for me. If it was something that had been on my radar during school, it may have been something I would have said, "Oh, that sounds interesting," but it was never even an option that I had heard of. And I fell into it by accident.
Hmm.
But I had, through vet school, considered going into a public corporate type of position. I really debated back and forth between small animal medicine or doing something that was more public corporate. I even started off my senior year doing public corporate and then switching to small animal medicine just because it was easier for me to get all my requirements in.
Hmm.
Um, but I kept that option open pretty late and then decided that full medicine was a good fit and I could do it pretty much anywhere, and I was getting married. So it almost was a natural thing for me to get offered something in shelter medicine and me say, "Oh, that sounds like a really interesting spin-off of small medicine." And it ended up being really, really interesting for me. I loved it.
Okay. I wonder, yeah, so apparently just from listening to you, Virginia, Maryland had tracking back when you were there.
Yes.
And
Mm-hmm.
so you could do public corporate or small animal. And I wonder if the public corporate track had classes on shelter medicine. Do you know?
At the time, they didn't.
They didn't. Okay. Yeah, I don't know if they do now. That's really interesting.
No, we didn't track until our fourth year. Like, they really didn't have classes specifically for different tracks.
Oh, how interesting. Okay.
Yeah.
Because when I started, that's when you pretty much started tracking. So the classes that the classroom lectures you attended of course there was a core, but then you could track, and then
Right.
you wouldn't have to take all of the large animal courses or equine courses, etc. So okay, so
Okay.
evolution there. And
Yeah.
let me ask you this, because this is every time I go into a shelter, I feel I don't know, I have nightmares and I get I think about certain dogs, the way they looked at me, and I want to adopt so many
Yeah.
of them. And were all the shelters where you worked, were they all no kill, or and if they were or if they weren't, how did you deal with meeting, certain animals just touch you um, really deeply, and how did you deal with
Yeah.
that and not end up with like a farm of dogs and cats?
um, Technically, all of the organizations that I have worked for were no kill. Um, in Virginia, that means that you release greater than 90% of your animals alive. Whether they're going to another shelter or a rescue organization or getting adopted. Um, they have a little leeway in between, um, and all those shelters that I worked for were definitely no kill. One of them, the first one, the SCCA, at the time, it was connected to the municipal shelter, but technically a separate organization, run by the same people. Complicated, and things are not set up that way anymore. But during that period of time, the municipal shelter was euthanizing animals, but the SPCA was not.
I
So I
see.
was around a lot of euthanasia. There were animals that I did have to make decisions about. Can this one come over to the SPCA and get adopted, or does it get euthanized? I did not have to do it very often, thank God, because that is not a position I ever want to be in. And that part I found difficult. I don't think too many people could actually, do that without difficulty. But for the most part, I was protected. By that, I didn't have to do that often. I still do, at all of those organizations, I could still do euthanasia when I thought it was appropriate, such as an animal that had a terminal illness or was suffering. We would euthanize.
Sure.
Sometimes for behavioral issues that we couldn't address,
Right.
we may euthanize as well.
Mhm.
So I still did a little bit. And some of those cases were hard, and some were challenged to make that decision at all. But I think for the most part, the organizations I worked for made relatively good choices. I think as my last job at Angels of CC probably had the most resources in order to help animals, as opposed to the other two organizations. But as time progresses, those organizations, have gotten to where they have more resources now too.
Mhm. Mhm. So your 8 cats, do they all come from the shelters?
Half of them,
Half of,
half of them did, yeah.
and where the other half
Yeah.
come from?
Um, my first cat I got at my very first job. She was a stray that came in as a kitten, and my second one came through when I was doing relief work, and she was a kitten that I just took. My third one came from the SPCA.
Mhm.
My fourth one came from the Franklin County Humane Society, and the rest came from Angels of the CC.
So it's 6 of them. 6 of them came from the shelters where you work. That's
Yeah,
awesome. Yeah. I
there's
mean, I'm sure that would happen to me if I worked at a shelter.
yeah.
Yeah. All right. So then, let's move on and talk about when you got to Angels of Assisi. Did they hire you as the medical director?
No, initially I actually was hired. There was another vet there who was acting as medical director, and I was hired specifically to start their wellness program, like a vaccine clinic. They
Right.
had surgery going, pretty well established, and the adoption center was there fairly well established, but they wanted to start a vaccine clinic. And the medical director who was there didn't really have interest in doing that, so they hired me specifically to start that. And so my first year, I think, was entirely doing the wellness clinic and trying to work it to the point that it eventually got. So we started off with just me and one assistant, and that was it. When I left there, the way we ran it was one doctor with two assistants, one working in one room and another working in the other, a checkout person, and occasionally an LVP. And we saw appointments every 5 minutes.
Every 5 minutes?
Yeah, now that was healthy, quote unquote healthy animal. If we knew that something was sick prior to them coming in, and it was something that was minor, that we didn't have to like hospitalize or anything, because we didn't do that. If it was like a skin issue or urinary tract issue, we would see them and we would schedule them for 15 minutes.
Wow.
So, yeah, it was very fast paced.
Yeah.
We tried to streamline everything that we could. So.
Was that your decision to make the appointments 5 minutes?
No. We had them at first scheduled for 10 minutes per appointment, and they were all healthy. And then over time, due to pressure from people above me, it kind of morphed into that. At every point that I didn't like something, kind of would fight it. And if something happened, I'd say, well, we'll try it this way. And if it's not working out, then we'll go back. And so things that worked out, we kept. And things that didn't work out, we didn't keep. But it actually ended up working out fairly well. Sometimes we'd get really behind, but other times we would run fairly smoothly.
Wow.
In 5 minutes. Yeah.
I can imagine if you're just seeing the animal and it's a healthy animal and that's all you're seeing, I can see it being doable in 5 minutes. But then there's a person that comes along with the animal and they want to talk. They want to talk about the weather or.
And that's how we were able to do it, is that they did not get to talk. They actually were not brought back with the animal.
Oh.
They sat out in the waiting room, and that was really the only way.
Okay.
That's the only way you can do it.
Yeah, exactly. Okay, interesting. Okay. And then, so then did the other vet who was the medical director decide to move on, and then you moved into that position?
Yes, exactly. So again,
So the other vet who was the medical director decided to move on, and then you moved into the medical director position. Is that what happened?
yes, that's what happened.
And how did your responsibilities change? Like, what was the biggest surprise of becoming a medical director versus what you had been doing before for Angels of Assisi?
Actually, it wasn't too bad of a change for me because I was already managing the wellness clinic part and doing almost all the work in the adoption center except for the surgeries. So it was just, I had that portion worked out and running really smoothly by the time I became medical director. So I only really had to take over a little bit more. So I also had a office manager that was very, very good. And so the two of us working together, it was actually quite smooth. I do enjoy doing surgery. So half of my time was spent in surgery and half of it was spent in the wellness clinic for many years. I worked at Angels of Assisi. There's probably about a year and a half time that I ended up doing surgery full time because we just didn't have a second doctor that could do the high volume surgery. But I really enjoyed doing both, and it gave me a chance to be in surgery half a week, and then half a week work with shelter animals as well as animals from the public. And I definitely learned a lot. Got really good and really quick at doing physical exams, and really good at doing spay neuter. I mean, it also afforded me a lot more leeway to do additional surgeries. Um, Not that I want to say practice on shelter animals, because we took it very seriously. Any like odd surgery that I would have was taken very seriously. But because there wasn't much other option in treatment, if an animal needed a surgery and I thought that I could do it from reading it and feeling comfortable with it, then I would do it. And so I actually learned to do a lot more surgery than I think I would have if I stayed in traditional medicine, because I may not have attempted it on an animal that had an owner.
Absolutely.
Um,
Absolutely.
you know,
So
so
what kind
it
of
definitely, it really, it helped my surgical skills quite a bit.
what kind of surgeries did you get to do that you wouldn't otherwise have gotten the opportunity to learn how to do?
Um, I did a colopexy for the first time on a shelter animal, um, like a gastropexy, but with the colon. And um, I actually did a lot more gastropexy too. I had done a few before I got into shelter medicine. Um, I ended up doing my first episioplasty as
Oh,
well, which
so
is
just
a
for
whole lot simpler than I ever anticipated it would be. Um,
Dr. Spangler, I'm sorry to interrupt, but just for the people that are listening who don't know what these surgeries are, could you just give a brief description of what they are?
sure. So the episioplasty is a surgery we take out a section of skin and some subcutaneous tissue between the rectum and the vulva, specifically to correct a recessed vulva. A lot of times that leads to continued vaginitis issues. And so basically you take out that piece of skin and subcu and you pull it up so that now the vulva is exposed to more air and easier to treat, so less likely to get infections in that area. And then colopexy is a procedure where you take the colon and actually suture it to the body wall so that it stays in place.
Hmm.
And that is to correct a prolapsed rectum.
Hmm.
Sometimes you can do that without surgery, but in cases where it continues to prolapse, the colopexy is really useful.
Yeah.
And the gastropexy is similar, but you're going to take the stomach and suture it to the body wall. There's a few different ways you can do that procedure, but in essence, it prevents the stomach from twisting, preventing bloat.
So, yeah. Okay. Thank you. So, these surgeries that you got to do, and you did them for the first time on your own, just from reading a book, and I think that's how a lot of veterinarians end up getting their surgical experience. And I think that there's some veterinary schools that are starting to partner with nearby shelters, to do that kind. I don't think there's anything wrong with it, and I don't think that you're doing it, you know, with the idea that the animals are just throwaway. I think they're animals that
Right.
need the surgery. Nobody else would do it otherwise. Nobody would pay for it. So it's a win-win deal if a veterinarian can learn how to do a procedure, and hopefully, it ends up being a successful surgery. And the animal wins,
Yeah.
maybe
And I
gets
felt
adopted because he got the surgery that he needed.
exactly.
So I don't see anything wrong with that. In fact, when I was in vet school, I think he was local. He was from somewhere in Virginia, but he came and taught to our class, and that's what he did. He volunteered his services for the shelters, and that's how he got his surgical experience. So
Right.
I think it's a win-win situation. Okay, so you when you were the medical director, that's when I met you at Angels of Assisi, and this was 2010, circa 2010. I was doing my fourth year rotation because I graduated 2011. I can't remember if I saw you spring, summer, or what, but um, tell me about how did it come to be that Angel of Assisi partnered with the veterinary school to take in vet students for their public corporate rotations?
And that actually preceded me being there. Um, I believe that the original veterinarian, her name was Kelly Farrell, she had started accepting veterinary students, and I don't know if she contacted them. Probably a student knew that she did that, asked her, and then it just became common knowledge that she would take students. By the time I took over as medical director, we had students almost every block, one or two. There was very few of the blocks during the year that we didn't have students, and that really continued up until I left, and they may still continue doing this when they get another full-time doctor in, which I think next month. So it was really a good program, and I learned just as much from vet students, I think, that they probably learned from me because being out of school for a while, I'd ask a ton of questions. Like, what are you learning about FIP now? And what are you learning about this and that? And it was a good way too for me to like check my skills or my knowledge, because I have to explain why I'm doing something. I need to learn it and understand it really well. So I think just the process of having to talk through something with a student really helps me a lot.
Yeah.
I really enjoyed teaching, and I think most students had a really good experience. We let students do long surgeries, and it got into a really almost to a science by the time I left, because I kind of knew where I could start students. I could really quickly evaluate them and try to help them progress on their own skill level. And so we pretty much always start students off doing cat space, cat neuters, dog neuters, and then once I saw their skill in cat space, then we would move on to dog space when they're ready. And usually by the end of 3 weeks, I could see like major increase in skill level.
Yeah, absolutely. I think that that was the best thing that I could have done, was to do a rotation with you, because all of the just experience handling tissue and handling instruments and watching you, seeing how calm you stayed no matter what happened, and it made a huge difference. So, and I started out in ER. I ended up having to do surgeries by myself in the middle of the night that I'd never done before, and I don't think it would have been possible at all if I hadn't had that experience at Angels. It still wasn't ideal, but
It's never ideal.
no, I don't think so. Not for veterinarians. So what made you like if you had so many different fourth year students coming through? In your mind, what distinguishes the really top-notch students that do a rotation with you? What are the qualities that they have or the attitudes that they have when they come to Angels?
Um, I love to see students that had a little bit of confidence, but were not overconfident. People who came in that said, okay, yeah, I'm willing to try that since you said that's okay. I want you to stand by my side until I have it, because I found that the two extremes made it really difficult to teach. Somebody who is so overconfident, they have trouble taking suggestions, and at that stage, till probably you're in practice for a good 5 years, you really don't know what you're doing.
That's so true.
The
Exactly.
overconfidence was hard, and then underconfidence, just because it was so difficult to like hug people up to make them believe in themselves. There's somebody who's sort of in between was the ideal student, because you can teach them almost anything if they have a little bit of confidence, but weren't too confident. Those are about the best teaching skill. There are definitely students that stood out as in having natural surgical ability. Sometimes there are people that had experience before they came, or it is natural and just picked up instruments and just like flew with them. And there are people that I could look at and say, okay, this person's not going to go into surgery, but as long as they could do basic suturing, it's probably fine. Most people were in between that, or they had decent skills, and it was just to be practiced, and that was me. I was not a surgical prodigy for sure. I didn't even think I liked surgery when I graduated from vet school. It scared me.
It's scary.
The sterility, the technicians yelling at me for standing in the wrong spot, that kind of stuff made me think I'm not ever going to do surgery. So I think I just got to where I was by doing it over and over and over and learning from mistakes.
Yeah, yeah. Speaking of mistakes, I wanted to say now it's been a long time since we've talked, but you've always been in my memory as one of my best experiences from vet school, and I can tell you that. And when I was there as a fourth year student, I was doing the spays and neuters, and there was a complication that happened. The cat that I was doing a spay on, she'd been dropped off by Good Samaritans who were looking after her. She was a feral cat. She'd had kittens, and they were going to look after her kittens just while she was having the surgery, and then they were going to return her to her babies after she'd recovered. So they brought her in for a spay. They were doing the right thing and wanted to prevent further overpopulation, homeless animals. And I did the spay, and she died on the table. And I don't know if I don't think you remember this, but she what had happened.
I don't remember the exact incident.
Yeah, the technician.
It did happen at the school of time.
Yeah.
While I was teaching, maybe 3 times, and it's always really hard.
Yeah. The technician had forgotten to hook her up to oxygen. And I was so experienced. I mean, even now I can remember I was watching her chest rise and fall, and I noticed that she seemed to be taking deeper breaths, but she wasn't taking deeper breaths. She was struggling, and potentially those were agonal breaths. But I was too inexperienced to recognize what I was seeing. And by the time we figured out what was going on, it was too late. And I was absolutely horrified. And I had to tell the woman who had brought the cat in that she during surgery, and she was very understanding and nice about it. But I don't think I've ever, fully gotten over the guilt of that incident. And you said to me, I remember, and this is not the only reason why you were one of my favorite, but certainly a big one. But you said to me later that day when I was doing something else, you said, I can see that you're blaming yourself for what happened, and I want you to stop it because it wasn't your fault. So I just wanted to thank you for that after all these years, because I think that it would have been even more emotionally traumatizing if you hadn't said that.
I completely understand, because in that position, me too, even when stuff like that happens, like an assistant doesn't turn the oxygen on and it's not noticed, it's a horrible accident. And even though I wasn't involved at all, I still feel responsible because it's my clinic. It's under my purview. So in the end, I'm responsible for it. It's hard. It's really hard to get yourself past that, because we're nurturers. We're taking care of things. It's our nature. And so when something goes wrong and it was preventable, it is guilt ridden. And in that situation, you really didn't do anything wrong. And a student doesn't have the experience to be able to pick up on those things. And I've had experience where that happened, where oxygen wasn't turned on, or the animals, came out or whatever. And I've been able to catch it because of experience and seeing, like, wait, this animal's not breathing right. You know, come and check it. While I'm doing surgery, I'll have somebody come and check on it. And so experience is like really important in those situations. A vet student's not going to be able, you know, to do that, or if they are, it's usually they got to do something else at the same time. It's really difficult to get used to doing 2 or 3 things at the same time. And I never blame, you know, students for anything like that.
Right.
And when I realize it's not like my direct fault when things like that happen, I still feel really responsible for it.
I'm sure. I'm sure. I think that's one of the hardest parts of being a veterinarian, you know, whether you're in shelter medicine or your private practice or relief, because mistakes do happen and, you know, complications occur and you always end up ultimately feeling responsible for them. So how do you deal with that, uh, you know, just as a human being?
Um, oh, that's a good question. I think we talked about this before. But I'm a very objective person. I've been, you know, personality tested, and I'm way on the objective end, which benefits me pretty well for the type of career that I have. Um, I am able to look at situations and analyze them in a factual way. And even if I feel kind of responsible for it, I can also at the same time tell myself, you know, what's wrong and the reality of the situation. And then I do compartmentalize very well. I put those in compartments and I'm able to get on with my day. Eventually, you gotta go back though and deal with those emotions. So every once in a while, you know, you have to sit down, talk about, you know, feelings on that level. Just been able to deal with um, those kind of situations, um, maybe better than someone that's more emotional, or on like a highly emotional scale.
Hmm.
I think it's just my personality suited for it.
Yeah, that's really interesting what you say though, is that because I mean, a lot of times these things happen and sorry, you can't stop the day to grieve. You're going to have to see the next client. You've got the next thing to do. So you've got to be able to turn that part of you off and get on with your work. But you said that you feel it's important at some point later to go back to that and allow yourself to emotionally process it. So
Yeah, you have to because
that's great
um,
advice.
it definitely will wear on you if you don't. Yeah,
Yeah. And so how do you emotionally process?
that's a tough one. I'm not sure I'm good at it yet. um, you know, for me, I try to um, in my some quiet time to think about that patient, um, the sadness or disappointment that I'll feel, you know, concerning that situation. Um, Getting better about it. Like, next time,
Yeah,
how can I prevent that?
right.
And I usually will go to steps about the prevention part. I don't always make them do the emotional part with me, but if they come to me because they're emotional about it, we'll certainly talk. Um, but I think it's really important to go back and look at what happened and then talk about what could we have done to prevent, and how are we going to do it from now on? Because not only for yourself, but for the owners too, who realize, you know, I'm always honest with clients, and if we've made a mistake, we've made a mistake, and we'll pay the penalty for it, you know, and we're really sorry. Um, this is what we're going to do in the future. So somebody else's pet is not going to go through the same thing. Somebody else, you know, another owner is not going to go through the same thing. And typically, I find that owners be responsive to that.
That is really, really fantastic advice. I love that. Going through and letting yourself feel the emotions so that you can process it that way, but also doing it with your staff. and for the purpose of helping them to emotionally process, but also how do we prevent this from happening? And I love, I never had that idea. It's a fantastic idea. I love actually telling the owner, this is what happened and we are so very sorry. And this, we've all had a meeting about it. And this is the changes that we're going to implement so that it doesn't happen to anybody else's pet. That's really wonderful. It takes a lot of courage.
It does. That's a hard thing to do. It's a really hard thing to do, to talk to an owner, especially when it's something that is avoidable. It's a very difficult thing to do.
Yeah. So, Dr. Spangler, I mean, you've got so much great experience and so much wisdom to offer. I think that we're probably I was being a little overambitious when I thought that we would talk about both your shelter experience and a clinic owner. And if you don't mind, I think maybe we'll try doing scheduling the talk about being a clinic owner later. And I'm a little bit concerned because this is the first time that I've recorded a live meeting, and I want to make sure that the sounds okay, that I can edit it, for you to spend like 2 hours, and it not turn out well. So if that's okay with you, I'd like to save the talk about your ownership for a different day. But let me just ask you, what in your experience as a shelter vet, what has been your biggest mistake or your biggest regret? And what advice would you give to veterinary students so that they might be able to avoid that?
That's a good question.
If it makes you uncomfortable, you don't have to answer it.
I think that the most difficult part of the question is just what is like my biggest regret. I think I have more like small regrets. I actually really loved doing shelter medicine. I think shelter medicine is very different because you are doing population medicine at the same time as doing individual animal medicine.
Yes.
And a lot of people can't approach that very easily. But the hardest part is the political stuff. Small animal medicine is like a small business fund entity. So you got smaller staff typically, unless you work for a large hospital. But most small animal clinics are 2, 3 doctor. Staff is relatively small. Your owner is your practice, the head veterinarian, and the social structure for the politics is very, very different than working for a humane organization. Usually, the person who is ultimately in charge is not a veterinarian. Sometimes there's multiple people on board that are in charge, and that can get a little complicated. So dealing with the politics of a shelter is more like dealing with politics in a corporation as opposed to a mom and pop business. And not to say that the mom and pop business is as important, but you as a veterinarian going to work at the shelter as opposed to a small business, the politics are totally different. I enjoyed working in the shelter and having that structure. And I could work in it because I realized that just because I'm the most educated person there, didn't mean I necessarily always made the best choice for the shelter. I could make the best choice for the animals all the time. That was my job. But I would come into political situations that had nothing to do with the animal's care, nothing to do with medicine at all. So I think that was probably the most frustrating part of medicine. And when I talk to other shelter vets, that's the most frustrating part, pretty much across the board, is dealing with the political structure in a shelter, whether it be municipal or privately run. Typically, it's being run by people who are not veterinarians, and the end goal is sometimes not the same as what the veterinarian wants to do. So, just figuring out how to work that system in a way, how to deal with that, how to make choices, how to present those choices in a way that it will be accepted. It's probably the biggest learning thing for me, and probably the most frustrating for almost all shelter members.
Wow. Okay. That's really interesting. I hadn't even considered that side of it, but yeah, it makes total sense now that you're talking about it. So if you're, our audience is people who want to be veterinarians in the future, what advice would you give to them if they think that shelter medicine is something that they want to go into? What can they do early on in their careers, either in vet school, or even before vet school, to prepare themselves to become shelter veterinarians?
Um, I think most shelter physicians are going to have a lot of surgery involved with them. Not all, but a lot of them will. So if you intend on having a position where you're going to need to be able to do a lot of spay neuter, I would definitely try to work on those skills so that when you get to the point of working in a shelter, you can be on the faster end. Once you start doing high volume, it's pretty quick. You can get past within about 6 months, I think. But having just really good basic skills is really important. From a medical standpoint, I don't know that there's really anything that you can do to prepare for it, because it's not like population medicine like in avian, like chickens or turkeys, and it's not like a traditional treating one animal at a time. It's a recombination.
Right.
Doing some work at a clinic or a shelter, volunteering, doing some through vet school will give you an idea of what you would need to be able to juggle. But really just having good skills before you go into shelter medicine, I think would be important. There's not too many new graduates that I would recommend going straight to shelter medicine, because typically you're going to be on your own. Even if there's one other doctor, they're busy. They can't help you all the time. So you need to have pretty good skills before you get into actually working as a shelter vet. Getting a little bit of like forensic background definitely could be helpful too.
Yes. You know what?
Depending on where you work, places, some humane societies are going to be a lot more active with animal neglect and animal abuse. You might work closely with animal control. Some places don't. My last job at anesthesia, I did. And having some forensic background for those type of cases is really important.
Yeah, the forensic, in your bio, you've got certificates in forensic medicine. And how did you get those?
I started at Angel, and they had an agreement with a local county that we would take all of their neglect and abuse cases, which ended up being a lot, because a lot of things are considered neglect that sometimes veterinarians would think of, like a collar that's embedded, animals that were just left outside and really thin. We would get those kind of animals. There was a lot that I would call the testing side. And sometimes they were just people were not educated. I mean, most of the time it's just uneducated people owning animals.
Yeah.
And sometimes it's a lot worse than that. Like sexual abuse, or I really didn't see any like direct like blunt force trauma or anything, but it could be. It has some pretty serious abuse cases. I started doing them and didn't really have any specific training. The Commonwealth attorney from Botetourt, the county that we were working with, is actually pretty well versed in the area of animal abuse and neglect from a legal standpoint. She actually lectures all around the country, and she suggested that I go ahead and do some of the continuing education. And she actually was really instrumental as well. They gave me books to learn from, tell me websites that I could check for information, and paperwork to use during my exams, things like that. So it was really helpful. And it's very interesting because you have to approach those cases from a completely different standpoint. For instance, you have a skinny dog, you want to deworm it because it probably has worms. They haven't eaten in a while. So it's totally collapsed. You can't deworm it. You can't just do a broad dewormer. You have to wait for species before you can treat them because it's evidence. So you have to have a different thinking as you're going into those cases. I examined a few dogs for sexual abuse. It's a very specific way to go about doing those exams. You're collecting samples, specific samples, and so I think so. Getting a little bit of education from that standpoint is very helpful. Looks great on a resume too.
Yeah.
So if they're really serious about going into that kind of medicine, I would get some experience there, and also joining the shelter vet association. They have a lot of links that you can help educate yourself with, and Cornell, Florida. You can go to a lot of different schools and find information there as well, and get a good basis of experience practicing as a small animal practitioner before you do it, just because I think having that base is really important.
Mm-hmm, mm-hmm. Yeah, surgical experience. So, did you get your certificates in forensic medicine online, or did you have to go somewhere to get them?
I did mine online. It is through, gosh, I'm trying to remember that NACV, I think.
Okay.
They offer online classes. You can use the CE, and I think there's six certificates to get.
That's great. Yeah. So after after vets graduate, I think they have 1 year grace period that they don't have to start working on their CE out continuing
Right.
education hours. But after that, you've got depending on which state you live in, there's a certain number that you're supposed to get every year. So you could do these online certificates in forensic medicine, and get 6 CE hours potentially for that. That's great.
Yeah.
All right. Well, now I'm going to ask you this again when we talk about your experience as a practice owner, and maybe by then you'll have more experience because you pretty much just started. But for now, what is the single biggest piece of advice you would like to give future veterinary doctors?
Oh, single mom. Ooh.
Or the one that you can think of on the spot. And the second time we do this, you'll have had more time to think about it.
I think one of the things that I would absolutely tell anyone who has not yet started vet school but is considering doing it is to really consider the financial aspect. I love what I do. I go to work every day, almost every day, and I'm happy to be there, happy to do it. Don't mind staying late all that often. But financially, I was very naive about what that would entail. I make a good living and I have a decent quality of life, but I do live with debt. Debt that probably would make an average person's head roll right off of their shoulders. So I think if I could give anybody some advice is to really think about the debt before taking it on, because veterinary pay is not as high as other professionals that have the same amount of debt that we have.
Right.
And that's a major issue. Just from, a standpoint of, your quality of life long term, a lot of money to pay back. And if I were going to do it all over again, I would really seriously consider it, just knowing what I know now, just because of the financial aspect. And that's the only reason I really love what I do. And I definitely, at this point in my career, wouldn't change it. But financially, it was a lot more dire than I ever thought it was before I went to that school, and that's just because I was financially naive.
Hmm. Yeah, yeah, same here. It was like, oh, it's, about the cost of a house. Well, I'd rather be a vet than have a house. No, you still need a house. Anyway,
You still got to live somewhere.
right, right, exactly. So, well, thank you so much for all of your time and wonderful advice. I just know that it's going to be super helpful to anybody listening.